What's going on, guys? It's Nathan here. Today we'll be talking about breast cancer. The overview. Breast cancer is a cancer that forms in the cells of the breast. After skin cancer, breast cancer is the most common cancer diagnosed in women in the United States. Breast cancer can occur in both men and women, but it's far more common in women. Substantial support for breast cancer awareness and research funding has helped create advances in the diagnosis and treatment of breast cancer. Breast cancer survival rates have increased, and the number of deaths associated with the disease is steadily declining, largely due to factors such as early detection, a new personalized approach to treatment, and a better understanding of the disease itself. I know I'm going to butcher some of these, or probably most of them, but here are some of the types of this. Angiosarcoma, DCIS, which is ductal carcinoma in situ, inflammatory breast cancer, invasive lobular carcinoma, lobular carcinoma in situ, or LCIS, male breast cancer, Paget's disease of the breast, recurrent breast cancer. Some of the symptoms you might, or signs that you might have breast cancer: breast lump or thickening that feels different from the surrounding tissues, changes in the size, shape, or appearance of the breast, changes to the skin over the breast such as dimpling, newly inverted nipple, peeling, scaling, crusting or flaking of the pigments area of skin surrounding the nipple, areola or breast skin, redness or pitting of the skin over your breast like the skin of an orange. When to see a doctor: if you find a lump or other changes in your breasts, even if a recent mammogram was normal, make an appointment with your healthcare provider for prompt evaluation. If you guys have any questions, just talk with your healthcare provider. I'm not a doctor. I know I say this in every video, but just want you guys to be safe and healthy and all that jazz. So some of the causes: doctors know that breast cancer occurs when some breast cells begin to grow abnormally. These cells divide more rapidly than healthy cells do and continue to accumulate, forming a lump or a mass. Cells might spread through your breast to your lymph nodes or to other parts of your body. Breast cancer most often begins with cells in the milk producing duct, invasive ductal carcinoma. Breast cancer may also begin in the glandular tissue called lobules, invasive lobular carcinoma, or in other cells or tissues within the breast. Researchers have identified hormonal, lifestyles, and environmental factors that may increase your risk of breast cancer, but it's not clear why some people who have no risk factors develop the cancer, yet other people with risk factors never do. It's likely that breast cancer is caused by a complex interaction of your genetics, makeup, and your environment. Inherited breast cancer. I know my family has, I think it's leukemia. I'm not totally sure. If my family's watching this, I'm not totally sure, but I think it's leukemia, and breast cancer are the main ones in my family, I believe. I know they start with L and stuff. So alright guys, let me always know what you're if you guys know, it's fine if you don't know, but what cancer your families are more prone to, because maybe your father, sister, cousin, or whatever has it, and you're more prone to it, you know what I'm saying? Inherited breast cancer. Doctors estimate that about 5 to 10% of breast cancers are linked to gene mutation passed through generations of family. A number of inherited mutated genes that can increase the likelihood of breast cancer has been identified. The most well-known are breast cancer gene BRCA1 and breast cancer gene 2, BRCA2, both of which significantly increase the risk of both breast and ovarian cancer. If you have a strong family history of breast cancer or other cancers, your doctor may recommend a blood test to help identify specific mutations in BRCA or other genes that are being passed through your family. Consider asking your doctor for a referral to a genetic counselor who can review your family health history. A genetic counselor can also discuss the benefits, risks, and limitations of genetic testing to assist you with sharing decision making. The risk factors, breast cancer risk factor is anything that makes it more likely you'll get breast cancer, but having one or even several breast cancer risk factors doesn't necessarily mean you'll develop this cancer. Many women who develop breast cancer have no known risk factors other than being a woman. Factors that are associated with an increased risk of breast cancer include being female. Women are more likely to develop this more than males. It does happen in males though, so it's not like ruled out. Increasing age. Your risk of breast cancer increases as you age. A personal history of breast cancer conditions. If you've had a breast biopsy that found lobular carcinoma in situ, LCIS, or a topical hyperplasia of the breast, you have an increased chance and risk of breast cancer. A personal history of breast cancer. If you've had breast cancer in one breast, you're more likely to develop it in the other one. A family history of breast cancer. If your mom, sister, daughter was diagnosed with breast cancer, particularly at a young age, your risk of breast cancer is increased. Still, the majority of people diagnosed with breast cancer have no family history of the disease. Inherited genes that increase cancer risks. Certain genes mutations that increase the risk of breast cancer can be passed down from parents to their children. The most well-known gene mutations are referred to as BRCA1 and BRCA2. These genes are greatly increase your risk of breast cancer and other cancers, but they don't make cancer inevitable. Radiation exposure. If you receive radiation treatment to your chest as a child or a young adult, your risk of breast cancer is increased. Obesity. Being obese increases your risk of being diagnosed with breast cancer. Or beginning your period at a younger age. Beginning your period before age 12 increases your risk of breast cancer. Beginning menopause at an older age. If you begin menopause at an older age, you're more likely to develop breast cancer. Having your first kid at an older age. Women who give birth to their first child after age 30 may have an increased risk of breast cancer, Have never been pregnant. Women who have never been pregnant have a greater risk of breast cancer than do women who have had one or more pregnancies. Post-menopausal hormone therapy. Women who take hormone therapy medication that combine estrogen and progesterone to treat the signs and symptoms of menopause have an increased risk of getting breast cancer. The risk of breast cancer decreases when women stop taking these medications. Drinking alcohol increases the risk of breast cancer. Preventions. Breast cancer risk reduction for women with an average risk. Making changes in your daily life may help reduce your risk of breast cancer. Ask your doctor about breast cancer screenings. Discuss with your doctor when to begin breast cancer screenings, exams, and tests, such as clinical breast exams and mammograms. Talk to your doctor about the benefits and risk of screenings. Together, you can decide what breast cancer screening strategies are right for you. Become familiar with your breasts, self-examine for breast awareness. Women may choose to become familiar with their breasts by occasionally inspecting their breasts during a breast self-exam for breast awareness. If there is a new change, lump, or other unusual sites in your breast or on your breast, talk to your doctor promptly. Breast awareness can't prevent breast cancer, but it can help you to better understand or normal changes that your breasts undergo and identify any unusual signs and symptoms. Drink alcohol in moderation, if at all. Limit the amount of alcohol you drink to no more than 1 drink a day if you choose to drink. Exercise most days of the week. Aim for at least 30 minutes of exercise on most days of the week. If you haven't been active lately, ask your doctor whether it's okay. Start slowly. Limit post-menopausal hormone therapy. Combination hormone therapy may increase the risk of breast cancer. Talk with your doctor about the benefits and risks of hormone therapy. Some women experience bothersome signs and symptoms during menopause, and for these women, the increased risk of breast cancer may be acceptable in order to relieve menopause signs and symptoms. To reduce the risk of breast cancer, use the low dose of hormone therapy possible for the shortest amount of time. Maintain a healthy weight. If your weight is healthy, work to maintain that weight. If you need to lose weight, ask your doctor about a healthy strategy to accomplish this. Reduce the number of calories you eat every day and slowly increase the amount of exercise. Choose a healthy diet. Women who eat a Mediterranean diet supplement with extra virgin oil and mixed nuts may have a reduced risk of breast cancer. The Mediterranean diet focuses mostly on a plant-based food such as fruits and vegetables, whole grains, and nuts. People who follow the Mediterranean diet choose healthy fats such as olive oil, oven butter, and fish instead of red meat. You don't have to do that. That's just example. Breast cancer risk reduction for women with a higher risk. If your doctor has assessed your family history and determined that you have other factors such as a precancerous breast condition that increases your risk of breast cancer, you may discuss options to reduce your risk such as preventative medication, chemo prevention, estrogen blocking medication such as selective estrogen receptor modulators and aromatase inhibitors. Reduce the risk of breast cancer in women with a high risk of the disease. These medications carry a risk of side effects, so doctors reserve these medications for women who have a very high risk of breast cancer. Discuss the benefits and risk with your doctors. Preventive surgery. Women with a very high risk of breast cancer may choose to have their healthy breasts surgically removed. They may also choose to have their healthy ovaries removed to reduce the risk of both breast cancer and ovarian cancer. Alright guys, I hope you guys enjoyed. If you did, make sure you give it a thumbs up. Hit that subscribe button, turn your bell notification so you never miss out. I hope you guys are enjoying these videos so far. I know I only have 2, but hope you guys are enjoying these so far. Hope these are helping in some way. If they are, make sure you share, subscribe, and talk. If you see anything like wrong with anything, just contact your healthcare provider, and or if you have like any questions, just let them know. I'm not a doctor by any means, but if you really want to ask me questions, I don't know everything, but I could research for you if you want, or you know what I'm saying? Okay. I just want you guys to be good and safe and all that jazz. So that's why I do these videos, to keep you guys like aware. And if you guys want to see like anything in specific, let me know down below. I love you guys. Stay safe. I will see you in the next video.